I believe aesthetic dentistry is, in the old days, and even today sometimes, we used to use different types of crowns. We used to use silver crowns, gold crowns. We used to put silver fillings in. Nowadays, everything that's done in the patient's mouth should be aesthetically pleasing. Aesthetics is a little different than cosmetic or smile dentistry. So aesthetically means when you put it in and you look in your mouth and they put a filling in there, you really shouldn't see the filling because it's aesthetically pleasing. You can do white crowns, you can do white fillings, you can do porcelain, you can do zirconium crowns. Basically, it's all white services or all tooth-colored restorations. Any form of that is basically an aesthetic service. Veneers are like a contact lens effect over the tooth. But the problem with the veneer, sometimes you don't have the strength. Sometimes over time you get the line that forms around the edge of the veneer, and sometimes they'll pop off. I've seen a number of patients who had veneers done in other offices. They come back, they come to me to rebond and then redo or consider a crown. A veneer is just the surface of the tooth. A crown is basically the same thing. It's white, beautiful restoration. It's different compositions. The thing about the crown, you have more control of the color. You have more control of any sort of rotation. If there's any sort of orthodontic issues or little rotation, you can correct all that. You have much more flexibility and variability with a crown, a full crown, than you do with a veneer. We do Zoom bleaching here, and it's a service that they get the best bang for their dollar, so to speak. You can get them in the office within 2 or 3 sessions in the office, one appointment. They get up to 8 to 10 shades brighter, depending on the color of their teeth. So that's the best and the easiest dollar to spend on that. We have what we call, in our profession, the dreaded black triangle disease. So if you smile, as you get older, your gums pull back and you got a black triangle in between your teeth. So it can be as simple as that, or it can be as major as with our patients here, is full mouth reconstruction, or just taking care of the front part of your smile zone. Yeah, so it can be to something very minimal to something very major. But sometimes the more natural tooth structure I can keep and get the perfect results that I want, that's ideal for me.